name is Carlos Wong. I'll be the physician assistant student taking care of you today. The purpose of today's exam is we will be doing an abdomen and a musculoskeletal exam. What I'm gonna have you do is I'm just gonna have you please take off your shirt, your shoes, your socks, and make sure your bladder is empty before we start this exam, and I'm going to wash my hands first, okay?
All right.
All right, so now that the patient has taken off their shirt, what I'm looking for now is making sure that I can see the xiphoid process to the pubic symphysis. For this, I'm just now gonna have the patient lay down and bend their knees while I extend the leg rest. Perfect. Before we begin with this exam, any pain that I should be aware about in the abdomen?
No.
No, perfect. So what I'm going to do first is I'm inspecting the contour of the abdomen, making sure of any scars, any striations, any sort of pulsations, anything that may be abnormal, any deformities. I'm gonna make sure of that first. Now I'm gonna move on to auscultation. What I'm gonna do here is I'm going to listen to all 4 quadrants, listening for any bowel sounds. And if I don't, I wanna make sure I listen to up to 1 full minute to ensure I hear those sounds. So I will proceed to do that now. All right, so I'm gonna start with the right upper quadrant, the left upper quadrant, the left lower quadrant, the right lower quadrant. Perfect. And while I'm doing that, I forgot to mention I should be also inspecting below the umbilicus as well, because that is very important. So now what I'm going to do is I'm now going to move on to percussing the 4 abdomens. What I'm going to be doing here is I will be listening for any dullness or tympany, and then I will also be palpating the spleen area just to make sure for any dullness or tympany as well.
Mm-hmm.
And I will make sure I do that looking for the anterior axillary line, and I will make sure that I look for the last intercostal space as well. So I'll proceed to do that now. Starting from the right upper quadrant, left upper quadrant, left lower quadrant, right lower quadrant. Sounds good. And then I'm gonna proceed to the spleen area. Gonna look for that last intercostal space. All right, so while I do this, I'm gonna have the patient breathe in and breathe out. Excellent, perfect. So now what I'm going to do is I'm going to move on to palpations. For palpations, I'm going to be doing both light and deep. For the light, I will be making sure I do it about 1 centimeter, and then for deep, I'll be doing it around 4 centimeter. Making sure I look for signs of distress from the patient, and making sure I look for any superficial or feel for any superficial or deep masses. So I'm going to start with the superficial palpations. Making sure I move around the umbilicus. Perfect. Now I'm going to begin with the deep. Sorry. Please let me know if you have any pain, okay? Okay, perfect. So now what I'm going to do is I'm going to look for liver enlargement as well. I'm gonna do what's called the sandwich method. I'm gonna have my left hand underneath the patient's left flank, and then I'm going to have my hand above the liver near the intercostal space, and I'm gonna have the patient breathe in while I palpate, and then you can exhale. Perfect. All right, now I'm going to do the same for the spleen, putting my non-dominant hand over the patient's left flank, and then doing the sandwich method again. I'm gonna have the patient breathe in, palpating, exhale. Perfect. Okay, so everything looks good and sounds normal. And then now I'm going to have the patient stand, or not stand up, but just lay up for me. And then I'm going to proceed to look for any CBA tenderness. I'm gonna have the patient please move to the side. And then I'm going to be looking for that CBA tenderness, just making sure if there's any pain from the patient. Any pain?
No.
Perfect. Any pain?
No.
Perfect. And then finally, we would end this off with a rectal exam. Perfect. So now I'm gonna have the patient look at me. We're moving to exam. For this exam, what we are going to do first is I'm inspecting and I will be palpating for symmetry, signs of inflammation, edema, effusions, any bone deformities, malignancies, any sort of muscular atrophy, abnormal movements, the condition of the surrounding tissues, crepitus, and just the overall range of motion as well. So I'm gonna have the patient first stand up for me. I'm going to be taking a look anteriorly and posteriorly for the posture of the patient. I'm then going to take a look at making sure I'm inspecting the spinous process, paravertebral areas, taking a look at the scapula, trapezius, making sure I take a look at the sacrum and the SI joint as well. And then I will proceed to actually palpate these areas. I'm gonna have the patient look towards me while I look for you. Yep, perfect. All right, so I'm gonna start with the scapula, making sure I palpate that, trapezius. All right, now the spinous process, paravertebral. Okay, the sacrum and the SI joint. Perfect. Okay, so now what I'm going to do is I'm going to move on to active range of motion for the cervical spine. For this, I'm just gonna have you follow my movements. We're first gonna do the flexion. I'm gonna have you bring your chin to your chest. That's flexion. Look all the way to the sky, that's extension. And then now I'm gonna have you rotate left to right with only your neck. That's rotation. And then with your ears to your shoulders, perfect, and that will be our lateral bending. So now what I'm going to proceed to do is I'm going to start with the thoracic and the lumbar spine range of motion. So for this one, I'm gonna have the patient do is I'm just gonna have the patient turn around for me. Perfect. I'm gonna hold, yep, I'm gonna have you face away from me. I'm gonna stabilize the patient. I'm gonna have them touch their toes. That's gonna be our flexation, perfect. I'm gonna have them lean back as far as they can. That will be their extension. And then now I'm gonna have them do like a washing machine motion. Gonna have you turn left to right, perfect. All right, and that's a rotation. And then finally, I'm gonna have you have your hands to the side of your hips and then try to reach for your knees. And that's our lateral bending as well. Excellent, perfect. Finally, I'm going to move on to the TMJ joint, looking for that. I'm gonna palpate that area, making sure I have the patient open and close their mouth. Perfect. Move your mouth side to side. Excellent. And then protrusion, and then retraction. Perfect. All right. Thank you very much. So now I'm gonna have you please take a seat for me. Okay, so now I will be inspecting the upper extremities now that we have finished our range of motions for our cervical, thoracic, lumbar spine, and our TMJ. So first thing I'm doing when I'm inspecting the upper extremities, I'm looking at the shoulders first, looking at the scapula, looking at the clavicle, looking for the AC joint, looking for the proximal humerus, as well as the arms now. I'm going to be looking at the biceps, triceps. I'm going to be looking at the lateral and medial epicondyle, the proximal radial head as well, and then taking a look at the forearm area. I'm going to be taking a look at the radial and ulnar styloid, and then I'll be looking at the carpal bones as well. So then we're moving on to our fingers and our wrists. I'm taking a look at the MCP joints as well as the ICP joints, and then the actual fingers as well, of course, and the anatomical snuff box. I will now proceed to palpate those areas. So first we're gonna start with the clavicle, the scapula, the brachial tendon or fossa, and then I'm going to make sure I palpate the proximal humerus. Perfect. So now I'm going to move on to the arm. I'm palpating the biceps first, the triceps, okay, the lateral epicondyle, the medial epicondyle, the antecubital fossa as well, and then the Ocardion process, your elbows, taking a look at that. Perfect. So now I'm going to move on to your forearms. I'm palpating the forearms. Then the ulnar and the radial styloid. Perfect. And then now the metacarp or the carpals. I'm going to flip your hand. Perfect. And then the other one. MCP joints, interphalangeal joints, individually. Okay, other hand. Perfect. So now we're going to actually move on to the range of motion for these upper extremities. So we're going to start with the shoulder. For this one, I'm going to have you do flexion, where I'm going to have you raise your hands all the way up. Perfect. And then bring them to the back of your back. Perfect. That's extension. And then I'm going to have you, now we're going to do rotation. I'm going to have you bring your hands up like a goalpost. That will be our external rotation. Then bring it down, internal rotation. For this one now, I'm going to have you then, let's take a look. Okay, so now we're going to bring them all the way out. We're going to do a deduction, just like this. And then we're going to bring them back in, kind of cross them apart like that. That will be our a deduction. And then our circumduction, I'm just going to have you kind of bring your hands in a circular motion. Perfect. All right, so we're done with that part. So now for the elbows, I'm just going to have you kind of bring your hands to your side. I'm going to now have you bring your hands to your shoulders. That's flexion, and then extend them all the way. That will be our extension. And then bring them back to position. I'm going to have you bring them, put your palms downwards. That's our pronation. And then bring them back up. That's our supination. And then finally, we're going to then move on to our wrists. For our wrist, I'm going to have you bend them upwards. That's our flexation, and then extend them outwards like this. Perfect. And then I'm going to have you do what's called ulnar deviation. I'm going to have you bring them in, and then radial deviation, bring them out. And then now we're going to move on to our fingers. So for our fingers, I'm going to have you kind of copy my motions. So we're going to do thumb flexion, finger flexion, and then we're going to do finger extension, thumb extension. And then we're going to do finger abduction, bring them in, and then bring them out. That's a deduction. Same for the thumb, abduction, adduction, away. Perfect. And then we're going to do thumb opposition, where you're going to take your fingers and press them on the thumb. Perfect. So now we're all done with our upper extremities, and we're going to move on to our lower extremities. I'm going to have you please lie down for me. Bring the seat, the rest up. Perfect. And then you can just lie your feet still. So what I'm going to do here is I'm taking a look at the hip, the thighs, the calves, and the feet. For the hips, what I'm inspecting first is I will be inspecting for the hip joint, the ASIS joint, and then the great trochanter. And then I'm going to move on to the calf area near the knee. What I'm looking for here is the lateral and the medial femoral epicondyle, the patella tendon, and then the tubercle tuberosity. And then I'm going to move on to the feet. What I'm looking for here is I'm looking at the internal and external malleus. And then I'm going to take a look at the heel, the Achilles tendon, and then making sure I take a look at the metatarsals, the IP joints, and then the toes itself. Okay, so now I'm going to proceed to palpate those areas. So I'm going to do the hip joint, greater trochanter, and the ASIS joint. Perfect. So now moving on to the thigh femoral area, I'm going to take a look at the patella first, the lateral femoral epicondyles, medial femoral epicondyles, okay? And then now the patellar, let's see, tendon, perfect. And then the tubercle tuberosity, perfect. Okay, so now I'm gonna take a look in the internal malleolus, external malleolus, the Achilles tendon, the heel, okay, the metatarsals, making sure I do it individually, okay. All right, and then the interphalangeal joints between the toes. Okay, and then the other side. Okay, and then making sure I actually do palpate the toes as well. Okay, perfect. So now we're gonna move on to range of motion. First, I'm just gonna sanitize my hands first. So now we're gonna do range of motion for our hips and the knees. So I'm just gonna have the patient lie down as he is right now. And then first thing I'm going to do is I'm going to do what's called passive range of motion. I will be doing this bilaterally. First, I'm going to take his right foot. I'm gonna bend it. And then we're going to be doing both knee and hip flexion. All right. And then I'm gonna do a full hip flexion all the way. Okay. And then I'm gonna extend it all the way out as well. And then I'm gonna bring it back to that same position. I'm gonna do a external rotation, internal rotation, and then I'm going to grab the patient's hip joint and I'm going to do a abduction, bring it all the way out. All right, and then bring it all the way back in, a deduction. Perfect. And then now I will proceed to do it on the other side. All right, so bring in that knee. I'm gonna passively do this. I'm gonna bring it in, knee and hip flexion, bring it all the way in, hip full flexion, and then extend it all the way out. That's our knee and hip extension. And then what I'm gonna do now, holding the patient's hip joint, I'm going to do a abduction, bring it all the way out, and then bring it in, a deduction, perfect. Bend it again. I'm gonna do a external rotation, and then an internal rotation, perfect. And then I'm gonna have you now lie on your sides. I'm gonna have you look away from me, so I'm gonna have you lie that way for me. Perfect. So holding the patient's hip joint, I'm going to extend the knee and the hip out, perfect. And then I'm gonna now have you lie on your side facing me. Okay, I'm gonna go from the other side now, holding the hip joint. All right, I'm going to then extend your hip out. Perfect. All right, and then you can lay back down normally. And I'm actually gonna have you lie up this time. Gonna bring this back in. So what I'm gonna do now is I'm taking a look at the feet. All right, so we're gonna look at the range of motion for the feet. What I'm doing here is I'm going to have the patient bring their feet all the way to the sky. That's our dorsal flexion, and then bring them all the way to the ground. That's our plantar flexion. And then what I'm gonna have the patient do now is I'm gonna have them bring his feet inwards. That's our inversion, and then bring them out, eversion. And then just with your toes, flex them for me. That's our flexion, and then extend them, bring them all the way to the sky. That's our extension. So perfect. So with that, we're done with that part. I'm gonna have the patient lie back down, and I'm just gonna sanitize my hands. All right, so I'm going to extend the leg rest out once more. Okay, make sure the patient's comfortable. All right, so now what I'm going to do is I'm going to measure for the calf circumference. So for this, I'm gonna have the patient bring just one calf up all the way, and I'm gonna take my measuring tape. I'm gonna start from I'm gonna find the biggest part of his calf. I'm gonna mark that area, and then I'm gonna make sure I measure that up to his knee. I'm gonna do this in inches, about 5. I'll make sure I take note of that. From that same area, I'm gonna measure around the calf. And that gives us about 16 inches, making sure I note that number. Perfect. You can bring this down and I will have you flex this one now. Perfect. So from that same area, I wanna make sure I take a look from the knee to the area where I found just about 6, I'd say. So right about here. I'm going to mark that area and then make sure I measure around the calf. Around 16. Perfect. So from my side, I see it's symmetrical. All right. So finally, what we're going to do now is we're going to measure the knee's active range of motion. For this one, I'm going to have the patient bring his right knee all the way to the back, his heel trying to reach more posteriorly to his back. Perfect. And then I'm going to take my geometer, goniometer, and then I'm going to make sure one side is near the line is touching the greater trochanter, and then one side is touching the lateral malleolus. And then I'm going to measure. So I'd say about 115. Perfect. And then I'm gonna have you relax this leg and then bring this leg and have your heels touch go all the way back as far as possible. Making sure I do the same thing. All right. For this one, I'd say it's about 120. All right, so with that concludes our exam.